So we're moving back inside with the weather getting colder. The holidays are pretty much upon us. And before either of those things really happen, we get word this week from the state's largest hospital system that they believe we're moving into now the fourth surge of the coronavirus. Let's talk it over with the state's leading medical officer, Dr. Natasha Bagdasarian. And Dr. Bagdasarian, it's our first chance to have you on Flashpoint. I really appreciate the time today. And let me start with your take. Does Beaumont have it right? Are we starting another surge?
I don't know if I'd say we're at the start of a surge. We are certainly in the thick of things. Cases are continuing to rise. This is a surge, but not the beginning. And I'll say that this surge actually feels quite different than previous ones because previous surges have been a very rapid increase in cases, and this has been a slow and steady rise since around September.
The other thing that keeps changing as we move forward is we have more and more tools at our disposal. We have the vaccine. We have now a vaccine for children. Unfortunately, our numbers each day as we report the daily totals are not broken down by who has and who hasn't had the vaccine. But that's still where the lion's share of the trouble is, isn't it? People who have not been vaccinated.
Absolutely. What we're seeing is there has been differential uptake in vaccine by age groups. And so when we look at the state overall, things look pretty okay. When we look at ages 16 plus, we can say that we are close to that 70% target that we had talked about so long ago. But when we break it down by age group, what we're actually seeing is that in elderly individuals, so those over 65 or over 75, vaccine uptake has been fantastic. We're looking at vaccine initiation rates close to 86%. And then that drops off as you look at younger age groups. When we look at 12 to 15-year-olds, it's only at about 42% vaccine uptake. And what we saw with this surge is that this surge really impacted children first. So the timing of this was really close to schools being back. And we saw that rise in transmission in 5 to 18-year-olds. And again, until recently, we didn't have a vaccine available for the very youngest among us.
We know from the questions that our Dr. Frank McGeorge receives on a daily basis, we have a lot of parents who are very concerned. They understand that this has been approved, but very concerned about getting out there and being among the first to get their children vaccinated. We have seen quite a few who are, but what would you say to parents who are really worried and hesitant? It's understandable fear, isn't it? It's something else to be thinking about your child as opposed to getting a vaccine for yourself.
Absolutely. And I would say that every parent out there wants to make the best possible decision for their child. And I understand that. I'm a mother of a young child myself. So I understand the fears and the concerns. But what I can say about this vaccine in particular is that the clinical trials were done in over 3,000 children, and there were no serious adverse events, which is really good news. But if we put those 3,000 children on one side for a moment, if we talk about the vaccines overall, they've been given to millions of people across the world. And that data, looking at millions of people across the world, really shows how safe and effective they are.
You have already talked before about, you've kind of lamented the political atmosphere that is infecting the work that you're trying to do. This past week, the New York Times, in their daily podcast, I thought it was very depressing, talked about a lot of public health officials who have left the public health sphere, hundreds and hundreds of them, because they've been undermined or worse, belittled, insulted, and the work that you've done, spent a lifetime accruing, the knowledge that you have is being usurped by a lot of people who obviously don't know anything about medicine and certainly don't know anything about public health. And I'm wondering about your thoughts on the climate that we're in right now when it comes to people like you who have we trust to have the expertise to help us get through this, being turned aside, ignored, or undermined at many turns.
Absolutely. I think it's a huge problem. Not only are we seeing this across the country, but we're seeing this right here in Michigan. We're talking to our colleagues in local public health departments, and they're seeing that they're feeling just burned out. They're dealing with vitriol. They're dealing with a lot of anger. There are school board meetings that have turned really ugly.
Yeah.
It's really unfortunate. And there are people who are leaving their jobs across the country and in Michigan. So what can we do? I think that this is the time to really think about our communities and to think about strengthening our communities, coming together, and really working towards ending the pandemic based on science and data. None of this should be political.
Let's hope so. Lastly, can you see, we keep wondering when we're going to turn the corner. Can you see the corner?
I think the way we need to think about this is not that the pandemic will all of a sudden one day end. It will be a process. Just like things built up to this point, it'll be a process and things won't happen overnight. But what we will start to see is that COVID will no longer be front and center in our conversations, and we can go back to a more normal way of living. This last year and a half, 2 years has been hard on all of us. I think that we've shared a collective trauma going through this pandemic together. So I think that things will gradually get back to normal, but this is not the time for people to just suddenly forget about COVID. Yeah. The point of time we're in right now is really critical. We have rising rates. We've had rates that have been rising since about the fall. We have a percent positivity that continues to go up, meaning that we need to really do more testing. We have outbreaks happening in K through 12 spaces. And then on top of that, the holidays are around the corner. People will be coming inside, they'll be gathering together, and we've got respiratory virus season heading our way as well. We're already hearing about influenza outbreaks. So while it's very tempting to say, let's just go back to normal right now, we're not quite there. And if we can get through this big surge, maybe on the other end of this, life can look a little bit more the way we want it to. But this fall, I really want to encourage people who have not been vaccinated to get vaccinated. And if you haven't had your flu shot, now's the time to get your flu shot as well.
All great advice. Doctor, thanks. It's so good to have you on the program. Thanks so much, and we will talk to you again soon.